Ladies, if you notice a little blood after mekwe and you immediately start thinking, is my period coming? Please don't ignore it. For if it keeps happening, don't ignore it. And if you've experienced it, let's talk about it. Hi, I'm Nurse Diaries and welcome to Nurse Diaries Health Hub. Bleeding after mekwe is called postcoital bleeding. Postcoital bleeding because sex itself is called coitus, so it is called postcoital bleeding. Sometimes it can happen because of something relatively simple, such as vaginal dryness, irritation, or a small injury from friction. It can also happen around certain times in your menstrual cycle. But here is where I want you to pay more attention. Bleeding after sex that keeps happening recurrently should be checked. Am I communicating? Yes, ma'am. There are other possible causes, including cervical inflammation or infection. We even have cervical polyps. I don't know if you've heard of that before. And changes in the cervix. In some cases, abnormal cervical changes can also cause bleeding after sex. So please, don't just keep saying, it's normal for me. My sister, it's not normal. If it is recurrent, if it comes recurrently, it's not normal. Especially if this is new, keeps recurring, it happens after menopause or comes with pelvic pain, unusual cervical discharges or other symptoms. Please, it is not normal. And ladies, please don't diagnose yourself from Google and start buying random medications. Any medication that you hear online, please verify. Go deep into it before absorbing. Get properly assessed. Your healthcare provider may recommend an examination and depending on your age, history, and screening status. I don't know if you've gone for your cervical screening. If you've not and you're experiencing that thing and you're keeping quiet, go for your cervical screening or any other test that has been recommended for you. Is very important. Remember, one episode doesn't automatically mean something is serious. That you had a vaginal bleeding today after sex, it doesn't mean that it is abnormal. But repeated unexplained bleeding deserves medical attention. Am I communicating? Yes, ma'am. So if you watch to this point, don't forget I'm Nurse Diaries, and this is Nurse Diaries Health Hub. In this our consultation room, our duty is helping women understand their bodies without fear or shame. And if you are a new mom preparing for life after delivery, my ebook, The New Mom's First 30 Days, is available on Amazon and Seller. Anywhere you can go, anyone you can afford, please go and purchase, have a copy. And it contains a practical guidance to help you navigate those important first days with your newborn. So if you watch to this point, go and grab your copy and I'll see you in my next video. Please, the link is on my bio. Go and get your own copy. And don't forget to follow for more tips. Subscribe to our page. Bye.